Hi, I'm Dr. Carl Stonecipher, and I want to talk to you a little bit about a new way forward in taking care of acquired ptosis or blood flare ptosis. So we now have a new exciting treatment, UPNEEQ. It's just recently been approved, and I want to talk to you about how I'm using that in my practice. Let's first talk about evaluating the upper eyelid and what I do clinically, because this may be not something that you normally do. I mean, you may not typically include this in your standard exam because you may not have had the opportunity to treat ptosis, or you may have referred it out before and now you have an opportunity to help these patients. So I like to look at that mean reflex distance, number one, but realistically what I like to do is all of us come in to the exam lane, and what do? We sit down and we start looking at the computer. We look at our electronic medical records. Well, this gives me a moment to stop and actually look at the patient, actually connect with the patient, and what I'm actually doing is seeing if there's any discrepancy, any asymmetry, or anything that's unique to this patient with regards to their upper eyelids. Now, if I find something unique, that's where we've got to be, how should I say, cordial in how we introduce it. You know, Mrs. Johnson, Mr. Smith, if you notice that your eyelids droop or that you have a narrow fissure, and 9 times out of 10 they'll say, you know, I'm a little bit conscious about that, but you know, I'm glad you brought that up and no one really ever talked to me about that. Well, you know, we have something that we can do about that now, so it's important that you and I discuss that today. And in many cases, I'm enabling my technician, if they see that, to actually bring up that conversation before. We're going to talk about that in a little bit later. Now, of course, when we're talking about acquired ptosis or new onset ptosis, we got to think about our differential diagnosis. And it's important, if there's any type of pathology, that we pick that up. So I think that never ever wants to escape our diagnostic armamentarium. So ptosis is very common. So it's kind of like dry eye disease in our practice. Before, we didn't really have a whole lot we could do for it, so we really didn't talk about it. And I'm talking about the days before, you know, cyclosporin and lifitegrast, and now that we have something that's available, these, you know, greater than 40-year-old patients and sometimes less than 40-year-old patients can actually benefit from this new product, UPNEEQ. Ptosis impacts us in so many different ways. Our daily activities of living, whether it's reducing what we actually see in terms of our visual function or our visual field, or whether it's a cosmetic appearance, I think that that's important. And it's not necessarily like we want to label, you know, the lady's a little bit more cosmetic and the male's a little less cosmetic and functional. I think this goes across the board, especially when you have an asymmetry or a dramatic ptosis like you see in this lady. And we're going to show you, in fact, what UPNEEQ does for her later. So ptosis can have a wide range of causes. We always say it's an older disease, but that's not necessarily true. It can occur with trauma, it can occur after our surgery, or in fact, it can occur after maybe we do Botox. So in my practice, have I ever dropped a lid? Sure. This is a way and an avenue how we can help with that if that happens in our Botox patients or our iatrogenic ptosis. But I think for the most part, contact lenses, trauma, surgery, there's a wide reason why we actually get ptosis, but it's more important for us to diagnose the ptosis and talk about it. So UPNEEQ. UPNEEQ is the first approved pharmacological treatment for acquired ptosis or blood flare ptosis, and it is indicated for the treatment of blood flare ptosis. So UPNEEQ is oxymetazoline. It's 0.1%. It's something that's been around for a long, long time. It's preservative-free, and we do it just once a day. So I say to the patient, you know, if you're not going out that day and you're not going to see anybody and you don't want to use it, it's not something that we have to use over and over and over again like a glaucoma drop to get an effect. It's instant. You put it in, you wait 15 minutes, and then you go out, and your ptosis or your droopy lid is improved, or your asymmetry is made more symmetric. And patients love that. So what actually happens with UPNEEQ or oxymetazoline? It has a 5-fold greater affinity for the alpha-2 receptor. So it's actually working on Mueller's muscle. And this is a medication that's been around that we've used in other products before. But this unique GUI allows us to put it in the patient's eye, be tolerable, comfortable, and work for hours at a time. So let's talk about the data for a moment. It actually raises our upper eyelids significantly. It improves that MRD1, or that mean reflex distance 1. It has a rapid onset and a sustained onset. So it's not like something that the patient's going to have to put in over and put in over and over and over again. It's something they can put in early in the day, and it has a sustained effect throughout the day, which patients love. But like I said, you can tell to the patient, hey, you don't necessarily have to put this in every single day to get an effect. It's instant. It's when you want it to work. But most importantly, I think what people don't talk about is it improves visual field. So when these patients' eyelid actually droop, they will notice that they don't see as well. And when you actually put in a sample drop for these patients, you'll actually, in fact, see them say, wow, who turned on the lights? So let's look at some cases, because I'm always kind of the before and after guy, and this is a mild case, but what I want you to look at is two things. Not only does it improve their ptotic lids, but it makes the patient look more symmetric. It makes the patient look more normal. It improves that lid crease like we see in a model or on the person that's on the cover of People magazine. Now, this is this lady that I showed you earlier with a more severe case, and that's the person that's going to look at you and say, Doc, not only did it make me look better, it made me see better. The lights got turned on. I can see more. And the most important thing, because a patient's not going to use a drop if it doesn't feel good, it's tolerable. It doesn't burn when you put it in. It's comfortable. So I have yet to have patients report back to me that I'm not going to use this drop because it irritated my eye, or I'm not going to use this drop because I got some other side effect from it. But I think for the most part, the patients find it easily instilled, as well as sustained effect, and more importantly, it's comfortable. So what do you talk about in a practice these days? Logistics. I don't want this to, take my practice down a notch. And Upneek and the people at RVL have made this very simple. And what we find is that I don't have to deal with anything. I look at the patient, I say, hey, look, I'm going to give you a few samples, which they've been very generous in providing samples. I say, use your cell phone, take a picture, put the drop in, and then take another picture 15 minutes so you can see what happens to you. But what I'm going to do for you, Mr. Smith or Mrs. Johnson, is I'm going to go ahead and I'm going to fax in a form that's a prescription. You don't have to deal with Medicare. You don't have to deal with insurance. It's $75 if you get it on a sustained benefit, and basically they're going to call you. Now, let's say the drop isn't for you. It doesn't work, which I doubt that's going to happen. But if it does, this company's not going to harass you. It's not going to keep calling you and saying you do want more. But on the other side of the coin, if you really like the drop, it's going to be delivered to your doorstep, so you don't have to go get it. And number two, they will call you back when you run out, or you'll have a number where you can access more of it. And it's very simple, and our patients have found it extremely convenient in terms of access to the medication. So how do I move my practice forward with Upneek if I'm somebody listening to this right now? Well, I think you first have to diagnose it, and I think you first have to enable those technicians to have that conversation with the patient. It's not just the doctor. And I think it gives us an opportunity to actually look at the patient when we walk in the room, because we're all guilty of looking over at that EMR, that computer, and basically, start typing away. So it gives us a chance to take a moment to kind of connect with the patient, look at their lids, see if they're symmetrical, and actually then bring up that conversation if they aren't. And then while they're sitting in the office, if we have time, I'll have my staff or myself put a drop in and then say, hey, we'll take a picture of you shortly after and show you what it does. So I appreciate your time. I appreciate the opportunity to let you learn a little bit more about Upneek. And I look forward to hopefully helping you with this product in your practice. Thank you very much.
Important safety information, warnings, and precautions. Alpha-adrenergic agonists as a class may impact blood pressure. Advise upneak patients with cardiovascular disease, orthostatic hypotension, and/or uncontrolled hypertension or hypotension to seek medical care if their condition worsens. Use upneak with caution in patients with cerebral or coronary insufficiency or Sjogren's syndrome. Advise patients to seek medical care if signs and symptoms of potentiation of vascular insufficiency develop. Upneak may increase the risk of angle closure glaucoma in patients with untreated narrow-angle glaucoma. Advise patients to seek immediate medical care if signs and symptoms of acute narrow-angle glaucoma develop. Patients should not touch the tip of the single patient use container to their eye or to any surface in order to avoid eye injury or contamination of the solution. Adverse reactions. Adverse reactions that occurred in 1 to 5% of subjects treated with upneak were punctate keratitis, conjunctival hyperemia, dry eye, blurred vision, installation site pain, eye irritation, and headache. Drug interactions. Alpha-adrenergic agonists as a class may impact blood pressure. Caution in using drugs such as beta blockers, antihypertensives, and/or cardiac glycosides is advised. Caution should also be exercised in patients receiving alpha-adrenergic receptor antagonists, such as in the treatment of cardiovascular disease or benign prostatic hypertrophy. Caution is advised in patients taking monoamine oxidase inhibitors, which can affect the metabolism and uptake of circulating amines. To report suspected adverse reactions or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report suspected adverse reactions to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.